Hey guys, it's Dr. Eric Shoemake. I want to talk to you today about a very controversial subject, and that is mammograms. There's been 2 studies that have come out recently really bringing into question the effectiveness of mammograms. I'm going to talk about that today. I get a lot of questions from women, specifically ages, I'd say 40 to 60, asking, should I get a mammogram? I've heard it's not good for you. Is it not? So the 2 studies that have come out recently, one was done at the Nordic Cochrane Center, and this is in Denmark, and they looked at one of the biggest studies ever, and they said if 2,000 women got screened every year for 10 years, it would save one woman's life. There would be 200 false positives, and 10 women would undergo chemotherapy, radiation, or surgery like a mastectomy unnecessarily from the false positives. So there's your statistics right there. And what the researcher said is that you're much more likely to get diagnosed with breast cancer if you have a mammogram. And a lot of that is because they catch things that would have gone away on their own. But on top of that, there's the radiation effect. So there's every mammogram is about 10 is literally 1,000 chest X-rays, which is a lot of radiation into your body. Physical trauma to the breast as well. And it's not catching it early. It has to be there for at least 6 years by the time you actually detect it on a mammogram. So I'm going to give you some better solutions in a minute. The other research study that just came out, this was in 2014, and this was all over the place. It was New York Times, it was the Wall Street Journal, it was on CNN, ABC, it was everywhere. And they found that there was actually, when they looked at the largest mammogram study ever done, they found that there was 0 decrease incidence of death from breast cancer in the screened group, which what that means is that it didn't stop people from dying, because the treatment or the solution to breast cancer is prevention. It's not treatment, all right? And it's not catching it 6 years after it's been there. So there's a couple things that you can do that are very effective when it comes to preventing breast cancer. One of them is called thermography. And at our event coming up on October 3rd, which is the women's only event, which I'm so excited about, we're actually going to give you information. I'm going to take you through the technology behind thermography, and it's completely non-invasive, no radiation whatsoever, and they can pick up any type of tumor or tumor activity that might be happening in your body 10 times sooner than a mammogram. So I'm going to talk about that at the event. So if you know anybody who's getting these mammograms, and especially these harmful mammograms in their 40s and 50s, then bring them to that event. The other question I wanted to answer today was from a patient who asked me about the BRCA gene. What about the BRCA gene when it comes to cancer? What's the risk factors there? And I call that the Angelina Jolie gene. Angelina Jolie had a preventative double mastectomy, which means she had both her breasts removed because they found this gene in her and told her that she had an 80% likelihood of getting cancer. What they didn't tell her is that she had the lifestyle that could turn that gene off. And there's 2 things that we're going to be teaching at this event that will completely cancel out the BRCA gene. So if you have a family history of breast cancer and you want to make sure you don't get it, make sure you're there on October 3rd. This is the most exciting thing that we've done in a long time. It's a women's only event. So we're going to take you through what to do about breast cancer, the 2 biggest things that you can do to decrease breast cancer risk by 200%. We're going to talk about osteoporosis and how that's mismanaged, and just aging in general is mismanaged, and how taking those calcium supplements that you're taking probably isn't a good idea, and how those can actually affect your heart in a negative way rather than helping your bones. We're going to talk about hormones, how to overcome menopause and what we call superwoman syndrome. And then we're also going to be talking about neurotransmitters, which is anxiety and depression. So this isn't just a breast cancer seminar. It's 3 hours where you're going to learn more than you've learned in the last 30 years about how to manage your health, take care of your health, and get your health and vitality back. So what I want you to do is make sure that you reply to this email. Tell Nicole who you're bringing with you. We'll reserve those seats. We need to know a name because we're going to have everybody on a register so that we know who's there. We're going to have goodie bags. We're going to have prize giveaways. It's going to be a blast, and we can't wait to see you there on Saturday, October 3rd from 10 to 1 at Smoky Hill United Methodist Church. So we'll see you there.